A physician associate is quite a new and exciting role that's entering the NHS, and we're trained to the medical model, which is the same model that all medics are trained to. More specifically, we're taught to take histories, do any physical examinations, order and interpret any tests, and then play a role in the diagnosis and management of our patients.
Before coming on this course, I initially studied a degree in anatomy and then did my teacher training and worked for a few years as a secondary school teacher. For the last 10 years I've worked in the NHS, but in an educational role rather than a clinical role.
Shortly after graduating, I worked in a project management office and then more recently worked at University Hospitals Birmingham in the research and development team.
I studied biomedical science, then I went on to do nursing, where I worked in an emergency department as a resource practitioner.
I came into this course having absolutely no clinical experience or any patient contact, but that was absolutely fine because they take you right back to the basics on day one, and I don't feel like I've been hindered by that in any way.
I live locally. I've lived in Birmingham for 10 years now. I've worked in some of the hospitals in Birmingham, so I know the local healthcare system.
It's very multicultural. The university is one of the oldest medical schools with very good reputation for the medical teaching.
There's a thing called
Birmingham offers quite a unique course in that it rotates between academic and clinical placements. So rather than having a whole year in theory and then a whole year in practice, we do 16 weeks at university, and then the following 14 weeks are spent in an acute trust learning and applying basic clinical medicine.
When you first go onto placement, it is incredibly scary. The first ward round in particular, where a consultant, invites you along and then starts firing questions at you, is incredibly daunting. But actually, I found the experience to be really supportive, and we weren't thrown into the deep end too much. It was a very, very safe environment in which to make mistakes and learn.
Our main hub is definitely the medical school, which is brilliant because it's got all the facilities we could want or need.
One of the biggest things I liked about Birmingham was the problem-based learning, which I quite enjoy compared to your typical lectures, which you have to sit through. And also you could direct your own learning, so you could sort of look into what you enjoy or what you don't understand and sort of look in more depth, which you can't get in your typical lecture learning at university.
The university also has lots of clinical skills rooms available to us, so when we're learning how to take blood or how to insert a cannula, we can go to specially equipped rooms with plastic arms, mannequins that we can use to practice those skills safely before we actually try and do those on real people.
We have the Barnes library downstairs that has all of our textbooks that we need. It's got really good space to work quietly. And for me, the best part about the campus is the university station that's literally just across the road.
In terms of career prospects, I think this course is broadening them a lot. So physician associates work in generalist medical roles, and they have to maintain their generalist status as they go on with their careers by taking revalidation examinations. That means that if we want to move from one area of medicine to another, we can do that much more easily than doctors and other medical professionals who need to retrain.
My aim, once I finish, is to go back into emergency department, where I'll be working as part of the medical model, to the medical team. And because I already worked in the emergency department, I know the day-to-day running of it, so I could sort of hit the floor running, and I could deliver more to the patient in terms of seeing them, diagnosing them, discharging the patients, which I wasn't able to do before.
At the moment, my particular areas of interest are ear, nose and throat and head and neck, so possibly think about moving into one of those areas in the future. But as I've been involved in education in the past, I'm also quite interested in educational roles within the PA profession as well. My advice for students thinking about coming on this course is to be aware how intensive the course is. It's recommended that we spend 50 hours a week studying. I tend to spend at least 60 hours a week studying.
If you can, to spend some time shadowing the physician associate or speaking to the physician associate so you get a better understanding of what the role involves.
This course is really hard work, but it's even more rewarding. So to anybody that's thinking about applying, I'd definitely say go for it, and I don't think you'd regret it.